Thank you for joining us for the 7th webinar in the Futures Policy Forum Initiative being led by the Alberta Association on Gerontology. My name is Chantel Zimmer and I'm the Vice President of AAG. I will be facilitating today's webinar on optimizing technology and innovation in the future delivery of senior services. Innovation in technology is viewed by some as a game changer for transforming the continuing care system and enhancing the quality of life of older adults. Today, we'll learn about what's happening in Denmark, Canada, and Alberta. Before we begin, I'm going to review a few important guidelines for the webinar. This webinar is being recorded and will be posted on the AAG website and YouTube channel for future viewing. All audience members' microphones have been muted and the chat has been disabled. If you do have questions or comments for our speakers, please place them in the Q&A box, which you can find at the bottom of your Zoom screen. And we'll have speakers answer your questions once all the presentations have been completed. This webinar series would not be made possible without the support of several sponsors, so we'd like to recognize them. The AAG would like to thank our platinum sponsors, our gold sponsors, and our silver and bronze sponsors. And it's my pleasure to introduce the platinum sponsor for today's webinar. We have Tim Murphy, the Vice President of Health with Alberta Innovates, who will tell us about his organization and the important work they're doing to support research and innovation. Tim, over to you.
Very good. Good day, everyone, and thank you very much, Chantel, for that great introduction. I want to talk about Alberta Innovates. Our work spans the full spectrum of sectors and industries, from healthcare providers to the health industry to patients, from forestry to food production, from artificial intelligence to academic research, and from clean energy to carbon capture. So we cover the entire waterfront of research and innovation. And not only do we assist early stages of idea or concept development, ideation in technology, but we're also helping our clients validate their technologies and scale their solutions and getting to helping them explore global markets and to create the partnerships and the winning conditions for their innovations to mature. We serve entrepreneurs, businesses, researchers, innovators at any point from discovery, validation, and use of that technology. So we make technical expertise available, we offer funding, we have networks and applied research and engineering capability that really works with the innovators to help them de-risk their technologies, stimulate startups, and actually draw funding and inward investment into the province of Alberta. So we have a little known fact is we have over 587 full-time equivalents in Alberta Innovates. We have 2 wholly owned applied research subsidiaries in Innotech and C4 Technologies. We have 11 facilities scattered across the province of Alberta. And I do bring greetings today on behalf of our president and CEO, Laura Kilcrease, who could not be here, but she sends her regards to this event and forum. And we're really proud to be a platinum sponsor of the Future Policy Forum, optimizing technology and innovation in the future delivery of senior services. And we look forward to this session today and to future partnership opportunities where we can advance healthcare for seniors beyond the 21st century. So thank you very much, Chantel, for the opportunity, and I'll turn it back to you.
Thanks for that great overview of Alberta Innovates. So today I'm joining from Calgary, and I'd like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary is home to Métis Nation of Alberta Region 3. The AAG acknowledges its presence on the lands of Indigenous peoples across Alberta. We're committed to ongoing dialogue and shared learning to achieve healthy aging and quality of life for older Albertans. Today's webinar is titled Optimizing Technology and Innovation in the Future Delivery of Senior Services. Technology offers the opportunity to improve the health and quality of life of older adults and create more sustainable healthcare solutions. In a recent study that was commissioned by AgeWell, the majority of Canadians 65 years or older who were surveyed believed that technological advancements could help them stay in their homes longer and manage their health better as they aged. And another study found that most Canadians thought technology and artificial intelligence could help solve issues affecting our healthcare system. As many of you know, the MNP Facility-Based Continuing Care Report that was released in 2021 recommended that Alberta develop and implement a research, innovation, and technology strategy for continuing care to transform the continuing care system. We do have many assistive technologies currently available to support activities of daily living and health monitoring for older adults. These technologies can contribute to a more efficient use of human resources within the senior services sector, but there is a general lack of awareness of the potential of technology and barriers to innovation, widespread implementation, and equitable access to technology. Today, we have with us a range of speakers who will be talking about technology in Denmark, Canada, and Alberta, and how it can be used in the delivery of senior services. They will discuss both opportunities and challenges for increasing the use of technology to improve care and quality of life for older adults. Our first presentation will be given by Christian Harslov, who's with the local government Denmark. Christian will discuss Denmark's approach to implementing technology to enhance its senior services and address workforce challenges. Christian, you can share your slides and begin.
Thank you so much. I will just share my slides with you. Here we go. All right. So first of all, thanks a lot for inviting me. It's a little past 8 in the evening in Copenhagen, where I am right now. So it's dark outside, and I'm in my study at home. It's so nice that I can be with you. Actually, 18 years ago, I worked for the Danish government at the embassy in Ottawa. So Canada holds a special place in my heart. It's nice to be with all of you. So I'm here to discuss a little bit how far we have come in Denmark regarding digital transformation in the senior sector in the Danish municipalities. And I think we share a lot of the same challenges between Denmark and Alberta and Canada and in general. But first of all, just let me introduce you a little bit to the Danish context. It's not too different from Alberta, actually. It's just beside the fact that I think Alberta is like 12 or 15 times larger in squares than Denmark is. But we have a population of 5.7 million, and we have a quite expanded public sector involved in most life events from kindergarten to schools to university, senior services, and so on. And we have what you would call a universal welfare model, that your welfare is paid for over your taxes, and it's sort of the Scandinavian model of welfare services. So you have quite high taxes, but in return you receive a lot of services that are insurance based in most other countries. So that's the Danish context. We have in Denmark 5 regions. Those are the brownish and greenish in the map here, and then we have 98 municipalities divided by all the black borders on the map. I represent the organization of the 98 municipalities, and they range from a few thousand inhabitants to Copenhagen municipality of a little more than 500,000 inhabitants. So that's the range that we have. In the Danish workforce in total, we have almost 3 million people. 420,000 of those are employed in the Danish municipalities. So it's quite a large share of the total number of employed in Denmark that are employed in the municipalities. We represent about one in 6 of every adult who has a job in Denmark, basically. The municipalities' tasks in regard to social welfare and healthcare. We run, I would say, about 90% of senior homes in Denmark are run by the municipalities. We have private alternatives, but it's not very widely spread. We provide home care for elderly, for long-term nursing care and home nursing care. We have a lot of preventive health measures. We run rehabilitation facilities outside of the hospitals, and we do a lot of social assistance for families and individuals, for instance, with disabilities or other social problems. So again, it's the universal welfare model that we run, and the municipalities are responsible for almost everything but the hospitals. The hospitals are run by the regions. We have 5 of those, as I showed you on the map. But apart from the hospitals and the GP, who is privately organized, we have almost everything within social welfare and healthcare in Denmark. So that's a little bit about the context, and now to the problem, I would say. And unfortunately, this gift that I'm about to show you is only in Danish, so I will translate a little bit for you. This is a graph illustrating the population growth in Denmark from 2018 onwards. And the blue line that is about to be drawn is children under the age of 5. Then we have persons from 6 to 17, that's the orange one. We have the adult population 18 to 79 years is the gray one. And then we have the yellow one, people from 80 and onwards. And what you can see is a massive increase in the number of people over 80 in Denmark, peaking in about 2055, 57. And then decreasing a little bit at the end of this graph. But as you can see, the aging population is indeed something that we need to address in Denmark. This has a lot of implications. Obviously, this means that a lot of more people need different senior services, healthcare services. But it also means that our labor market is changing rapidly. We will have a lot of people on retirement from this day onwards, and we will have less people in the working age. So this is a double demographic problem that we have. In numbers, this is about 400,000 extra people in the next 20 years or 25 years from 80 and upwards. And I didn't bring that graph, but we know that once you turn 80, this is where you begin to demand healthcare services and senior services in a lot larger need than when you're younger. So this is a big problem for us. And I think for a lot of countries in the Western world. Another way to put it is in some other numbers. As you can see, already in 2030, we will have 150,000 extra people over the age of 80. And we have some statistics on shortfall of employees in the public sector. We assess that we will have a shortfall in 2030 in the public sector of employees of about 44,000. And as I showed you, in the municipal sector, we have 420,000 employees at the moment. So this number includes the regions as well. So this is a shortfall of about 7-8% in the workforce. Alone in the social and healthcare sector, it's 16,000 people. The social and healthcare sector in the municipalities is about 100,000 employees. So this is about 16% that we will fall short in 2030. Already now we can see that 44% of the jobs are not being we are not able to hire anybody in the jobs in 44% of the cases. So we have vacancy notices for 44% of the jobs already now. So we need to find other solutions. A lot of political initiatives have been taken over the years to address these issues. This is the healthcare reform I will come back to what's the content of the reforms. The healthcare reform, was it called in 2022? I wouldn't call it a reform per se, but at least a number of political initiatives to sort of transform the healthcare sector, to use more telemedicine on chronic disease, and to address chronic disease in different ways using much more technology. As you can see, we're still working on a voluntary basis, so that if patients insist on seeing a doctor face to face, they can still do that. But we're trying to turn to more technology-based treatment. Another initiative from the Social Democratic government at the time was to initiate national partnerships for welfare technology. They pointed out 3 front-runner municipalities and it's established a welfare technology education, and they invested 50 million Danish kroners, which is about 10 million Canadian dollars, in spreading welfare technology throughout the municipalities. The organization that I represent, Local Government Denmark, and in short, in Danish, that is KL. That's why there's also a KL logo in my slides. But we also established a political statement in 2022 called "Rethink the Welfare Through Digitalization." And our aim with this political document is to be able to underline the importance of using technology when developing welfare services, not only for seniors and healthcare, but widely in the Danish municipal sector. And then in the bottom right corner, we have the strategy for digitalization in the public sector in Denmark. This covers the regions, the municipalities, and the governmental level, and has a lot of initiatives, and for instance, on healthcare issues. So home treatment is a big initiative in that strategy. We have an ambition of releasing 10,000 full-time jobs equivalent in the next 10 years using technology. And another initiative here is better access to health data to work with AI and so on. So a lot of political focus, but this is difficult. I think every 98 municipality in Denmark has tried to implement these technologies, and it is always difficult. And when it's sort of the implementation in the organization is difficult, the implementation among the users is difficult, and the relatives to the seniors are not always reassured that this is the same quality of care as they would receive on a more normal basis. But in the last, I would say, 5 to 6 years, we have seen another will and another acknowledgement of the fact that technology can be very useful, and with these strategies, as I just showed you, we have come some part of the way. But what has been the primary driver, no doubt about that, has been our shortage of labor. So this has been the dominant driver in this transformation that has just begun in the Danish senior sector. So what's important to stress at this moment is that when implementing technology in the last, I would say, 10, 12 years in Denmark, we have had a lot of different aims with our implementation of technology. Mostly quality improvements has been the main aim. Cost reduction has been another aim. And those are still important aims. But what is now primarily in focus is the ability to unlock time or expand capacity. So we need to implement technologies that can do those things for us, so we can address our labor shortage. And this can be done in many ways, but we approach it in two different ways. One of the ways is that we investigate new technologies that can actually transform our services. Implementing those technologies is on a long-term scale. So this is not something that we can do within a year or 2 or 3, but maybe within 5 or 6 or 10 years, we can transform welfare using new technologies that are unknown to us at the moment, but sort of in their prime and emerging technologies. But what we can also use, and that's what we focus on at the moment, is to take advantage of technology that has already proven its worth, and then implement that. Either technology that has proven its worth in other sectors, or in some parts of the country, and then we can scale up and spread to other parts of the countries. So for an organization as KL, that I'm representing at the moment, our job is, among a lot of other things, to spread these good examples and to take these examples and try to document the effects of everything that we have been working on. And we have done that with a case analysis that I will present to you some findings from that. This has been made in collaboration with Deloitte Consulting, and our aim with this was to get sort of hardcore evidence that it is possible to find technologies that can improve efficiency and quality at the same time and reduce the demand for labor. Actually, this has been it's been quite difficult for us in the past 10 years to find genuine documentation that we have technology that can reduce the need for labor. A lot of people actually say that technology drives development in a way that is actually doing the opposite. So with extra technology, we get extra possibilities to provide healthcare, and that drives cost and demand for labor. But these technologies actually work with the focus on minimizing the demand for labor. So the case analysis is not solely for healthcare and senior services. So I have extracted the examples from this analysis that are relevant for our topic today, and it will also show you a little bit about the methodology. So these are the 10 examples we have, and a lot of them in the right map. In the map on the right hand side, you can see the municipalities, and then the logos in the middle, and then you can see the names of the 10 projects that we have been working with. And now I will zoom into a few of them and how we have been working with it. So my first case here is on-screen visits. This has been booming during the pandemic, of course, but we have kept on to the most valuable of it. So not every time, but in some of the visits that the municipal nurse provides to the citizens, they are not actually doing any physical care. Rather, they are observing the seniors if they take their medication correctly, if they're eating properly, if they're able to dress themselves, or so on and so forth. So that can be done using a screen instead. So what we have been doing is to gather information. This is from the municipality of Vejle, one of the larger municipalities in Denmark, and they have tested this in 2 districts in the municipality, and they have been able to reduce the number of visits with about 15%. That unlocks 113.5 hours of visits per citizen in the study here. It reduces costs by 4,400 Canadian dollars, and we have a 94% satisfaction from the users. And the users in this case are the seniors, not the employees. So this is a win-win-win situation where we have reduced costs, we have improved satisfaction, and we have reduced the demand for labor. And the main benefit for the seniors is that they feel more in charge of their day. They're not sitting waiting for the home nurse to come and visit them, and the staff reduces their time in the cars, basically, where they drive from one home to the next. So that's the benefit on the hours. Another technology that is now widely used in the Danish nursing homes are these transfer technologies, tilt and rotation systems. These are for people who are in their beds most of the time, almost all day. And this case comes from the city of Copenhagen that implemented these technologies in their medium-sized and large nursing homes. These actual numbers come from one senior home with 68 residents, and what we can see is that the care capacity, we had an increase in utilization of the care assistance capacity by 18%, which is sort of saying something about how many citizens can they be around during the day. Per nursing home, we had a saving of about 91,000 Canadian dollars. This is more or less equivalent to one nurse per nursing home that we have been receiving. 20% of the residents in the nursing home could use this technology. So this is a measure of the fact that 20% of the residents were in such bad condition that they were in bed almost all time. So a lot of potential for this technology as well. Then we have a medication robot. This is a smaller business case, but nevertheless, this is good. These are for people who are stably medicated, but receive a lot of different medication. So the robot is filled once a week by the staff, and then 3 times a day, or how it's programmed, the citizens receive their medicine. Doses packed, and they can take it. And if they need observation, that can be done using the screen. This releases 1 hour per week per staff working with these issues. That's not a lot, but it's okay. And you can see very correct dispensed. The pills are dispensed very correctly, and this user satisfaction is also very high. The last one I brought to you today is online training and rehabilitation. This is something that we are working intensely with in the Danish municipalities at the moment. This has a really interesting potential. The picture you see in the bottom left side is a training session. So the physiotherapist at the right side is educating the citizens in using the tablet that is placed on the table at this moment. But obviously, when the technology is implemented, the citizen will look at the screen, and the different exercises will be provided to the citizen on the screen. and she then will have to duplicate what is being done on the screen. This needs to be the only disadvantage of this technology is that the education side of it is quite intense. The citizens need to be educated quite thoroughly in using this correctly. But as you can see, this has quite a big potential. 27 hours annually is a lot in rehabilitation because this is not a very intense. This is not nearly as intense as home care. Rehabilitation is maybe once or twice a week, whereas you get your home care maybe 4 or 5 times a day. So 27 hours in that respect is quite a lot. And as you can see, the physical improvement is quite good. 55% may not sound like a lot, but this is this meets the standards of normal rehabilitation quite well for this group of patients. If you combine some of these technologies, you will actually be able to create nursing homes in private homes. And this is another vision that we're working with. So instead of moving people into nursing homes, we move technology into the homes of the people where they live already, and then we can let people stay in their normal environments, not having to move into nursing homes. So this is the perspective on a more long-term basis. Yes, so basically that was what I have brought for you today. Just let me say that this problem of ours in recruiting sufficient staff is something that we need to work with at least for the next 30-40 years with the demographics that we look into. And technology is, as we see it, our best opportunity to be able to meet these demands. So this is now sort of the backbone of every political document that we make in these years regarding senior services and healthcare. This is a picture of our current recruitment strategy, and everything in this document is about implementing technology, is about educating our staff in using technology, which is quite a big problem as well. Implementing these technologies is hard work because there's a lot of resistance among the staff and among some of the citizens as well, some of the seniors as well. So how to work by motivating the staff, the seniors, and getting these capabilities into the schools where we educate the nurses and so on and so forth is a big focus for us as well. Yes, so that's it for me. Thank you so much.
Thank you very much, Christian, for sharing. Next, we're going to hear from Dr. Alex Michailidis, who is the Associate Vice President for International Partnerships at the University of Toronto, and he's also the Scientific Director of AgeWell. Alex is going to discuss the increasing role of technology in supporting individuals as they grow older and assisting their care partners. Alex, you can share your slides and begin.
Great, thank you, Chantal. Everyone can see my slides okay? Great. Well, thanks so much to the Alberta Association of Gerontology for inviting me to speak today. And as Chantal mentioned, I am the Scientific Director and CEO of an organization called AgeWell, which is a national coast-to-coast-to-coast network of researchers, older adults, caregivers, care providers, industry representation, and various policymakers, all working towards the development of technology to support aging and older and their caregivers. When I came up with the title, the role of age tech in supporting older Albertans, I reached out to my family in Alberta, in Edmonton. I apologize to those from Calgary that my family's in Edmonton. and ask them, well, what are some of the special kind of needs that you may have as growing older in Alberta? And really what I learned is there's no difference between an older Albertan and anyone else in the provinces and territories. So I kept the title, but just to forewarn you, everything I'm going to be talking about here is really applicable, not just in Canada, but also around the world as well. And I really appreciated Christian's presentation, because when we're building Age Well and we look at other countries around the world, examples from the Netherlands and from Denmark typically come to the top of the list in terms of the work that you're doing there. So it was really great to have actually Christian maybe open up this session with his presentation. So I'm not going to get into any of the demographics. We all know we're growing older. We all know that Canada is growing older, but one of the things that people don't realize is that Canada is considered one of the super aged countries around the world. And that is meaning that by the year 2050, approximately 1/3 of our population is going to be over the age of 65. So we are the only country that's considered super aged in North America. And so often we think about a lot of these issues around aging, and typically think, well, that's in Japan and Asia and elsewhere, that they're the ones with the issues with older adults. But the problem is here as well. And what we saw over the past 3 years with the pandemic truly has shone a light on some of the major issues that older people have in Canada, across the country, and specifically how technology could have filled many of those gaps moving forward. So let's get going here. So first off, what do we mean by age tech? And so as we've been developing new technologies for older adults and been developing really a sector of companies and researchers, et cetera, around the world, we needed a way to label this. And so if you look at a lot of the other industries like financial services, et cetera, they use the term fintech, et cetera. And so we really want to follow that line of naming, which would show that technologies for older adults is a real sector. In fact, it's estimated that in the US, this sector is going to be in the trillions of dollars because of the aging population. And so we use the name age tech here in Canada, and in fact, age tech is used in other parts of the world as well. And it's really defined as any type of technology that improves the lives of aging adults, including things like fintech, et cetera. So you'll notice here that we use a very broad definition. It's not just about healthcare technologies. It's not just about technologies that monitor your vital signs or that provides medication, et cetera, but really anything that allows you to continue to participate and be active in your own life as you grow older. And that's even in the face of various diseases and afflictions like dementia or changes in your mobility, et cetera. And hence also the word aging well or age well, that everyone can age well with the right interventions in place. And here is age tech. Now, that raises always the question now of what is an age tech? We've been using the term technology for aging or age tech, et cetera, really in the sense that, as soon as you turn 65, you're considered an older adult here in Canada. And so what does that mean for technology? And so, if I use now an Apple smartwatch to monitor my vital signs, and helping me maintain good health or to improve my life, as I mentioned here, as soon as I turn 65, does that mean my Apple Watch is considered age tech or just regular technology? And so again, this is really one of those debates that's coming out that, we're all aging, we're all getting older, obviously, which is better than the alternative. And so the question also then raises, what is considered technology specific for older adults, or, do we really need to have a life course approach to this? The bigger question that we also look at within Age Well is who uses age tech, and who are the ones who are actually now purchasing these devices, and who is really formulating the sector, so to speak. And obviously, they are purchased by older people, and Chantel gave some stats from AgeWell, and I'll share some further ones in a second. And so there is evidence that older people are buying these technologies. And in fact, in Canada, in recent years, the number one demographic for people buying smartphones, for example, are those over the age of 65. And so that whole aspect of, well, older people don't like technology really is more myth than reality these days, and this obviously will change. The second demographic that we see are the caregivers of family members who are actually buying the technology on behalf of the older people. And again, this is a change that I've seen over the past several years within this field of technology for aging, is that caregivers are becoming the consumers. They're the ones who are becoming the installers of the technology. They maintain the technology often, and they're the ones now that are asking, well, why is it so hard to get these technologies? Why can I not just go into my local big box electronics store or home improvement store and buy these various technologies, whether they're smart home systems, et cetera, on behalf of the person I'm providing care to? And again, we're now starting to see, at least in Canada, a shift from these devices being traditional healthcare devices that requires doctors or occupational therapists or physical therapists to prescribe, to being more consumer products. The final circle, though, is the one that I think is the most important, and that is the delivery to future older people. And it really raises the question of who we design these technologies for. Is it the current older adult demographic, or is it the future one, which is increasingly obviously becoming the baby boomers, who in some ways are more comfortable with technology, and in many ways have far greater expectations that technology will be part of their everyday lives, and in fact, part of their healthcare and well-being as well. And so it's a fine balance that we need to always look at when we're developing these technologies and marketing them to current older adults, but also obviously to the future population as well, maybe 3 to 5 years down the road. So Chantel gave some initial stats in the survey that AgeWell did, but I just want to add some additional ones. So again, this is kind of just looking at that myth that older people don't like technology. As mentioned, 3/4 of Canadians over the age of 50 are confident using current technology. 2/3, just jumping to the bottom point for a second, 2/3 over the age of 50 believe that technology can help lessen the impact of COVID on daily life. The second point is the one, though, that I really want to point out, and I think is the most important, because we always get the question of, well, who's going to pay for this? Where should the payments come from? Should it be the government? Should it be, the health authorities, et cetera? But in fact, 2/3 of older adults, when they're asked whether they'd be willing to pay for these technologies, they are willing to do so, as long as it means that they can stay in their home as age and that they can have good health and good well-being. Now, obviously, there are still issues of equity and access to these technologies, especially here in Canada, among our Indigenous communities, other rural communities as well. But obviously people live in urban settings. And so, again, this is a fine line with respect to the policy that we need to be looking at in terms of how to get these technologies in the hands of the individuals, but perhaps most importantly, from a design perspective, how do we keep the costs as low as possible? And we're really starting to see costs drop in these technologies as they become more mature moving forward. So what I want to do now is just really to show you some examples of technologies that are currently under development in our various research labs across the country. Now, I'm not going to talk about ones that are available off the shelf, but happy to share that in our Q&A period. AgeWell has put out or has helped support about 65 startup companies, who many of which are still running, which is a great metric for success, obviously, and they're selling product. And again, I'm happy to share that later on. But when you look at areas of promise with respect to technology for older people currently and in the future, what we've seen in AgeWell is really areas of promise across 3 different verticals, and that's smart homes, robotics, and big data, and each one would have several different types of projects within them. So I'll show you a video for each one right now. So this is first an example of a very, well, I would say very early, but it's still an ongoing project, but started about 20 years ago, of how do we keep older people with dementia within their own homes, especially as they need more and more assistance to complete activities of daily living. And so we've been doing a lot of work around prompting systems, right from the technologies themselves to the role of artificial intelligence to learn about the person, and also around the types of prompts that are required. So I'll play this video. Keep in mind, this is an actual person with dementia. For anyone familiar, for example, with the mini mental state exam, 30 out of 30 is perfect score. Typically we would all score about 28, 29 out of 30. She has a score of 6 out of 30, so she has quite severe dementia. So I'll play the video now.
Oh my God, yes, promise. Oh,
Louisa,
all right.
you're doing great.
Thank you.
Put the knobs to turn the water off.
All right, yes. Oh God, this is good.
Okay, so hopefully you saw and heard that video okay, but essentially what happened there is, the system detected that Rosa here, she pretty much always played with the water and would never turn it off, and that would always be the main prompt. But the key things here that you saw is this technology using artificial intelligence has learned about Rosa and the type of prompting that's required from her. And so, this was about 2 weeks in. It knew that it always needed to address her by name to get her attention, and always needed a video prompt as opposed just to a plain audio prompt. And so started directly with that. Okay, so the next example I'm going to show you is around robotics and using artificial intelligence. And in this case, it's using robotics to do cognitive testing of older people. And this can be done in a clinic, for example, but can also be done at home. And so what you see here is, the picture naming task, where you ask a person to describe what's in the picture, and then based on that, they can do an assessment of the person's cognition. And so here we've automated that, so not only can we understand, detect what the person is saying and analyze that, but we can also analyze the way they're saying it. So looking at the number of utterances, how many start and stops they have when they're speaking, etc. So we can actually take a much deeper and richer data set here than a clinician could in order to make this analysis. So I'll just play the video here.
My name is Pepper. Today I will be guiding you through a simple test to screen for dementia. In a few moments, I will show you a picture on my tablet. All you need to do is describe what you see. Let's get started.
Doing the dishes. And he's into the cookie jar for his sister. And she let the water run over in the sink.
Great job. Thanks for doing this together with me. That was a lot of fun. While we wait, let me tell you more about this test. Just now I showed you a picture on my tablet and asked you to describe it to me. Your response can tell us more about how you express what you see. Sometimes we can use these results to screen if someone may be at risk of developing dementia. Remember, the results of this test are only for screening, so you will have to see your doctor for more accurate results. Thank you for your patience. Your results show some differences between other healthy participants. Since this is only a screening, it might be a good idea to speak with your doctor for more accurate results.
Okay, so again, there's an example of how we use robotics and artificial intelligence in this diagnosis. Actually, in predicting also the changes in person's cognition. And so The important thing here is that, again, this is a screening tool. It's not the robot doing the diagnostics. It's basically running the test, but then suggesting that the person go see their doctor for actual real intervention. So again, the key thing here is we're not using these technologies to replace the caregivers or the clinicians or the health team themselves. Okay, so the final project I'm showing, no video here, but really just what I want to demonstrate is, it's great that, we can use these technologies to do screening of cognition or to help prompt older people with dementia. But really the prediction is the holy grail in what we're doing. And that's why, artificial intelligence has become so important. And so what you see here in the top corner is a radial plot of motion sensors that have been put into a person's home over the period of 3 years. And so every time they're in the room, there's the sensor fires, and then we get one of the dots that you see here. And what you can see by just understanding where the person is within their house, you can get a fairly good representation after a while in terms of what they do and what their daily schedule is. And so, here you can see that from about 11 p.m. to about 7, they're in their bedroom, hopefully asleep. Then they're doing their morning activities here, and then maybe here they went out for a walk, and then they come back, do more activities across the different areas of the room, etc. And so this type of data here is very powerful just on its own, right? Because you can see this, you can take a snapshot of what the person is doing. Perhaps all of a sudden you're seeing that they're not in their bedroom as much. Perhaps they're not sleeping as well. They're going to the bathroom, twice as many times as usual, which may indicate something like a UTI, etc. But again, as I said, prediction is the key thing here. Is we want to try to predict changes in an older person's health, whether cognitive or motor or sensory, before it actually happens, in order to put the right interventions in place. And so what you see here in this chart here is the use of various types of machine learning and predictive algorithms from the field of AI. And what you can see in the top row here that's highlighted is that after 3 months of collecting this data, with about 85% accuracy, we're actually able to predict who will develop dementia over the next year. And so again, you can imagine this can be a quite powerful tool, not for diagnosing, but again, for recommending to the person, to the caregivers, to the family that, there's something unusual happening here that may lead to a change in a person's cognition. So, let's start putting interventions in place, or obviously having them go see their doctor or some type of specialist if needed. Okay, so to finish off, the question is, what is the future of this area? And I spoke a lot about artificial intelligence and robotics, and I truly believe, that we will start seeing these devices more and more in people's homes. And we're already seeing many examples of artificial intelligence is being used, such as in people's, Alexa devices or Google devices, etc. Again, in the news lately, we've heard a lot about these chatbots. So these automated conversation agents that you work with, or that you type something and they give something back. And you may have all heard of Chat GPT, which is something that has been in the news a lot lately, where you can basically ask it anything, it'll give you an answer, which is very human-like, I would say. And so I thought, just for fun, I thought, well, let's see if Chat GPT could be a caregiver. And so I took statements that we actually have heard in our trials, and to see how Chat GPT would respond to it. And so, for example, here it says, where are my glasses? And this bot comes back and says, I'm sorry, I can't help you with that, as I'm not aware of your physical surroundings. You may try checking the last place you remember. So again, not very useful information. And again, the key thing here is that these chat bots do not have situational awareness. They don't know what's going on around you. They don't know what you're doing and what you're trying to do. And so it gives these very kind of standard responses. Is it time for my pills? Unable to check the current time. But I can tell you that it's important to follow the dosing instructions provided by your healthcare provider for your medication. Okay, again, thank you, not very useful information because it does understand the context of what's happening. Finally, this is one that I always love when we hear, I can't remember how to use this bloody teapot. And this is when we were developing robotics to help people prepare meals. And Chat GPT comes back actually probably with the best answer we've seen, where it actually gives you a list of how do you actually do that. And so it's this, again, this type of chat bot, this type of artificial intelligence that we're seeing more and more of in our daily lives, even if we don't realize it. But at the end of the day, can it be useful for older people moving forward? And again, currently right now, I would say no, but again, these are things that we're going to see in the future. So finally, what I'm going to do is just show a very quick video to finish off, if I have time, really to talk about, age well and the importance of networks and partnerships in moving these goals forward. And that's just not partnerships across Canada, but international partnerships as well. And this is truly a global challenge to solve, and we can't do it in silos, and that's really, really important. So I'll just play this video quickly, and then I'm done.
The aging population is one of the greatest achievements, but also one of the biggest challenges of this century. We launch AgeWell knowing that technology can play a crucial role in addressing these challenges.
AgeWell really helped us with allowing us to tap into this network of different individuals and really creating our own interdisciplinary team.
These innovations are the future of senior citizens in Canada. They're going to help us stay at home, live longer lives, and live better lives. It's all out there.
AgeWell was able to connect us with mentors, advisors, and a whole bunch of different resources to help us in our journey.
Incentivizer wouldn't be here without AgeWell. So AgeWell has basically been instrumental in everything we do.
AgeWell was really critical in not only providing financial support, but also in offering mentorship, connections, as well as visibility through their events and workshops. Through all of these different resources, we were able to be very cost efficient early on and actually get to market much faster than we otherwise would have.
AgeWell's training program is completely unique across the world. We support undergraduate students, graduate students, college students, postdocs, clinicians from a multiplicity of disciplines. We support them to learn all the things they do not currently learn in their programs or in their current careers.
The AgeWell program is certainly different than anything I've ever done before. It really expands your horizons and your mind.
My work would have never gone to the point that it's gotten to without AgeWell really being part of this project from the start.
was a caregiver at 30. I always say aging well is a luxury. And I'm glad there's Age Well to help you hopefully get to that luxury.
I'm inspired every day by the spirit of innovation that runs through this network. Congratulations to everyone who has worked so hard to accomplish so much. We're going to keep driving the age tech sector in Canada, creating jobs, supporting our economy, and making life better for people everywhere.
And with that, thanks very much, and I look forward to the questions.
Thank you very much, Alex. It's been interesting to see some of the technology developed in Denmark and now in Canada. So with that, I'm going to turn it over to Tim Murphy, Vice President of Health with Alberta Innovates, who's going to discuss current issues preventing the scale-up of technology in the delivery of seniors care within Alberta and some strategies to make use of technology for this purpose.
Very good. Thank you, Chantel, for that introduction. Welcome, everyone. That was two great presentations from Christian and Alex. Thank you very much for that. I've just taking a lot of notes and learning a great deal about this. But what I'm going to talk about now is the Alberta experience in accelerating digital health technologies for older adults for this forum. And I guess I start off the presentation by just saying that every industry today is a tech industry, except for healthcare, right? So I just wanted to just contextualize that for a second. Advertising, one thinks of Google. Music, we think of Apple and Spotify. With retail, I think everyone's had the Amazon experience of them anticipating, predicting what your needs are, whether you want the product or not. You seem to get that on the way you deal with the technology. Media with Facebook, and the list goes on and on. Food and agriculture with Monsanto and John Deere. These are all things that are happening. So I guess the one thing is as Alex pointed out, all these businesses are IP-driven and data-driven businesses, right? So data is really at the heart of how this moves in the digitization world. And for our part at Alberta Innovates, we were formed in 2016, as I said in the introductory comments, and we're pivoting to these emerging technologies and how to incorporate that. Right now, Alberta Innovates reports since 2016 to the Ministry of Technology and Innovation in Alberta. But the key point of this slide is we service the whole of government. So we service all the various ministries in the province of Alberta. And as I said in my intro, we have two wholly owned subsidiaries in Alberta Innovates who do a lot of the certification testing, sensor testing, technology de-risking for companies. They do that mainly in the oil and gas industry, given Alberta's economy, but they're pivoting as well now to that data-driven digital economy that both Christian and Alex had talked about. And the goal of our organization is really to be the indisputably recognized global leader in catalyzing research and innovation. And as Alex said, work in partnership with all of our communities. So what is the role of Alberta Innovates? This slide just lays out the three parts of our role. Number one is we are a funder, but we're also a service provider. As is often said, and I often say it myself, is we are more than our money. I think we talked about in the earlier presentations about partnerships and collaborations and co-design. We help facilitate and catalyze that activity. Secondly, we are a partner and collaborator. We help get the right resources to the right innovator and researcher at the right time in the right place, such that they could fail fast in their technology development and we can move on and go forward, or they can become successful and find those global markets to add value to the citizens of Alberta and beyond. And the last part of our role is a convener connector, bringing industry groups together, bringing students together, bringing entrepreneurs together, bringing capital, coaching, and community together to help accelerate our clients on their client journey, their success. And probably the best example of what we do in that space is our annual conference in Ventures, which is occurring May 31st, June 1st, and June 2nd this year in Calgary. It's a 3,000 participant conference. We have about 200 panels. We are going to have a seniors panel this year and a seniors activity around the event of Ventures. So those are the examples of what we do as a corporation. I won't spend a lot of time on this slide because I think Christian did a really good job of laying out the challenges moving forward. But in Alberta, at least, Healthcare consumes about 41%, roughly, the provincial budget, and growing. That's a huge area. So how do we approach that in terms of trying to create a digital data-enabled economy? We have our 4 focused areas of investment. One is on the research side, which is linked to discovery of how you come up with ideas. We have a technology commercialization unit that focuses on commercializing technologies. We have the receptor capacity of the health system and how that best applies and uses those technologies. And then we have a talent development strategy that helps grow the enterprise. So with those 4 focused areas, we deploy our dollars. And when I'm talking about in our dollars, it's about $48 million annually that we spend. We have about 200 projects right now on the go, and we have about $163 million of active investment that the health team works on. Well, Christian really nailed this out for us, but I just wanted to give you the Alberta context. As we all know, we're all aging, that's known, but healthcare costs increase dramatically with age. So this slide is from Professor Trevor Tome from the University of Calgary. You see the dollars per capita of 2015 on the y-axis, and then the age breakdown stratification. You see in Alberta, the red bars outpace the Canadian bars. So while we have the same country and we can learn from each other as the provinces and territories work together in this national, and then as Alex said, the international collaborations are really important. In Alberta, we have a healthcare challenge, and we spend one of the most per capita on healthcare, and that's also increased dramatically. And those red bars in total will represent about $6 billion in additional cost, aging alone, over the next coming years. So that's going to be a huge challenge that we have to deal with, and that's why innovation is so important, and that's why technology is so critically important for us. This slide just talks about the shifting the paradigm, and this slide sort of sets up our strategy of how we view this. You see on the x-axis cost of care, on the y-axis quality of life. As you go up the y-axis, your quality of life increases. On the x-axis, your cost increases. And right now, acute care is a very costly physical environment where you get the care, right? So that's going to be hospital centralized care, and very provider-led, provider-dominant. And that's where we spend the majority of our $23 billion in Alberta on that activity. Going upstream a bit, we have primary care, which is the primary care clinics, mainly through the primary care networks. And we just had an announcement yesterday in Alberta about modernizing Alberta's primary care system, MAPS, which is trying to help strengthen that. And that's where about 80% of the care is provided in healthcare. And then as Alex and Christian both highlighted, the last sort of area is healthy communities, right? You're connected home, connected by data, very consumer-driven activity. So, what is moving us from, that lower bottom corner to the upper left-hand corner? There's really 4 key drivers. I've already mentioned cost. The second one is technology. We know that the technology today enables that shift to occur towards the healthier homes with proper placement and proper evaluation and evidence that the shift can take place. We know that the social determinants of health drive 75% of health outcome. If we want to improve health outcome for all, including seniors, how do we best deal with those determinants of health to help drive that? And the last one, the fourth one, is just the rise of consumerism. And I mean, every other aspect of our lives, as that first slide I showed illustrated, it's more connected, it's more individualized, it's more personalized. And so too should our healthcare system and those are the experiences that are shaping our thinking as consumers, as we think about healthcare moving forward, as we try to get to healthier communities. So how are we approaching it at Alberta Innovates? We have programs, platforms, and partnerships. You see here on the slide, just we have this client journey model that we use around discover, ideating, conceptualizing. In the middle part, sort of is the validation of the innovation and the validation of the technology. And on the far right is kind of the scaling, establishing, leading, or the population uptake and use of that technology. And I won't go into great detail. I can talk more about this at the question and answer period, but this lays out the programs we have and the Accelerated Innovation into Care program that populates that entire client journey for the innovator. We have platforms that support them underneath that help them work with their strategy for patient-oriented research around taking a patient-centric approach to technology design and how best that can be done. We have the RECCE program, which does the ethical application of ethical principles to non-research projects. And we also have partnerships we've established in the ecosystem that help us enable trade that. We don't do everything. We're not all things to all people, but we do try to create a continuum for the innovator to be successful to get to market. I'll just go into two examples on the seniors front, and this is from our ACE Validate program. We have the chatbot, which really is an assessment for frailty in seniors. And of course, as there's a Johns Hopkins study that found that frailty doubles the risk of surgical complications for the seniors population, increases length of stay, creates more dependent adults, and should be assessed and addressed at the earliest stage possible. That concept of going upstream and identifying frailty early before one gets into the situation downstream. So we did have the opportunity to use computer technology, may hold some answers. We had an AI-powered chatbot with the assistance of our partners, and I'll just mention our partners, Makata Health, Alberta Innovates in the primary care, Edmonton O'Damon network in Alberta. Data privacy security is key, ensuring that the patients and care team can use the technology and use the chatbot, and it also had to be user-friendly. The early signs of what we've seen is that the clinicians felt that the chatbot was helpful in triaging patients with frailty. That's a good thing. And then it would benefit in the delivering of the frailty assessment would be one of the key outcomes. And I just listed some of the barriers and enablers to that particular project. And of course, all projects, one of the big barriers, of course, is interoperability. It's taking the information from the chatbot and coding it into the electronic medical record. If the systems can't talk to each other, that's a huge challenge. I think it was Alex who mentioned the issue of seniors purchasing. We had issues with regard to not everyone had a cell phone. So there's an inclusivity challenge around how you ensure people have a cell phone, and then do they have the connectivity for the cell phone to avail themselves of that technology. Some of the enablers were clinicians attending focus groups, and I think the co-creation process of the project development sessions empowered by Alberta Innovates in terms of how our team worked with those partners to help make that project a success. The second project I'll just highlight quickly is one around, and Christian mentioned about the labor reducing technologies and how that's important. And this is about training informal dementia caregivers through immersive education. And again, the challenge, of course, is dementia is a huge problem. It's on the rise. 42,000 in Alberta today, 155,000 by 2050. It impacts both the formal and informal caregivers. I saw a stat with the MAPS project that said, I think it's 50-50, the number of formal versus informal caregivers in society today. So a huge population of people that need to be trained. The opportunity was to work with the workforce, train them, empower them in the informal care providers, working with realistic situations around VR situations and helping ensure that they're co-designing and co-developing the opportunity. The outcome of this particular project in partnership with Red Iron, Alberta Innovates, and Lethbridge College was a market-ready product, the establishment of partnerships, and a couple of the barriers are just the pace of change in the virtual reality world. Things are happening so quickly, that's a challenge, and the lack of health-specific certification body to sort of assure the public and purchasers that this technology is of value and it has a benefit. The enablers, again, were more the people side of the technology, focus groups, and then the development sessions that we help facilitate at Alberta Innovates. So that just gives you a sample of two examples of work we're doing right now at Alberta Innovates. I think the conclusions that I took from this, and I think it's important, I think both Christian and Alex mentioned it around the culture of innovation in seniors to help address the high impact needs, and aligning stakeholder incentives offers a critical path for seniors innovation. I think that culture is really important. It exists in pockets, and we have to ensure that we have the scale and spread across the population. The next part, research innovation agencies like Alberta Innovates are playing an evolving role to drive seniors innovation with diverse stakeholders. I think the key thing is to seek the willingness to advance, and I talk about the coalition of the willing that we work with. So we try to work with the coalition of the willing as opposed to the unwilling to help advance these technologies and make these things happen and find those pockets and then scale and grow from those groups. And the last thing is just the public-private partnerships. And I think with Christian in Denmark, I was very impressed when I visited Denmark in October of 2022, just the maturity of their public-private partnerships and how they drive innovation. And I think that would build trust to accelerate the pace of innovation. We can learn a lot from the Danish system, plus others around the world, for how best to do that. So with that, I will stop talking. Thank you very much. And I look forward to the questions and answers, and I'll turn it back to you, Chantel. Thank you.
Thank you, Jim, for your presentation. Next, we have two presenters, Dr. Haidong Yang, Executive Director of West End Seniors Activity Center, and Barbara Gibson, President of the Board of Directors, are going to discuss technology that their center has used to benefit older adults during the COVID-19 pandemic.
All right, thank you for all the presenters, and in particular, team, I really like what you just said, because that's exactly what the West End Seniors Activity Center is going to talk about. It's the partnership. So today, like Chantel mentioned, we have our president, who is also our member of the organization as well. So she's going to share some of the experience during the pandemic. So I would like to go to the next slide. So my presentation actually is extremely simple, just this one slide. So I just want you to take a look at the picture in the middle. You might wonder, why did I put March 15th, Sunday, 2020? Why that is so special for West End Seniors Activity Center? So as many of the people who are from Edmonton or Alberta may remember, for Edmonton for sure, on March 13, the whole city shut down due to the pandemic. So over the weekend, me and my staff already start working on an 8-week fitness program for seniors. And within 1 week, we're already able to produce the videos. It's about 20 videos and 16 videos actually, and 20 pages of written description. We're able to share that with our members. And throughout the pandemic, we noticed that we have to rely on our partners. Otherwise, we're not going to be able to serve our seniors. That's the reason why we've immediately formed the YAG Seniors Alliance with 3 other organizations. Edmonton Senior Center, that is mainly serving the low-income seniors, seniors with disabilities, seniors who self-identify as LGBTQ2S+, and Indigenous seniors. Drive Happiness, that provides affordable transportation for seniors. And then ICANN Seniors Association, which mainly serves seniors across Alberta, like Asian seniors across Alberta. So we partnered together, and in April 2020, we're already able to offer over 100 online programs to seniors across Alberta. I was actually quite proud that one day I was wondering about where people are taking the classes from us. So at first it was just like Edmonton, and then Calgary, Grand Prairie, some of the little town like Leduc, St. Albert. And then later I found out I started having some clients joining our classes from BC, from Ontario. And the one that I was most proud of is a lady from Germany that's actually taking our classes. And I was like, wow, okay, technology, internet, that's powerful. So, okay, because of COVID, so we need to do our program. So of course, we're using the Zoom, we're using the Facebook, we're using the website. So our president will share more of the specific examples with you. But one thing I really wanted to emphasize is that we all know seniors have challenges in using technology. So West End Seniors Activity Center, one of the great things that we did was to provide the one-on-one technology training to seniors. And we were able to, by the end of December, by the end of 2020, we're able to offer individual one-on-one personal training to over 800 seniors. I mean, individual seniors. That doesn't include the seniors who return, right? So we're not counting those numbers. And then we always talk about technology when we think technology are like smartphone, internet, that kind of stuff, but we forgot something like phone calls, telephone, landline. Those are technology as well. So West End Seniors Activity Center was able to immediately recruit volunteers to make weekly friendly phone calls to hundreds of seniors who are isolated. So our president will share with you her experience and also some of the amazing story. And just one last thing I want to mention today is that West End Seniors Activity Center is actually currently partnering with Alberta Innovate on multiple projects. And I look forward to continue work with Alberta Innovate, and we're developing an app. So we're hoping to serve more seniors in Alberta. Okay, President, I would like to pass that to you. Thank you.
Thank you, Haidong, and thank you to all the speakers. As president of the West End Seniors Activity Center, we so appreciated the staff helping both me and the entire board in learning how to use Zoom. Our board activities were able to continue during the entire pandemic, and so this was great. Our email was always used to distribute the agendas, our minutes, our reports, etc. But I think one of the most important aspects, one of our goals at the center was to use technology to help seniors stay socially connected and to decrease the social isolation to these seniors during COVID. We all know that this can lead to all sorts of health concerns. And so for myself, I was able to use Zoom to continue on with my exercise classes. And that was really nice because it provided normalcy for me, and that I could continue to see and dialogue with my peer group and with the instructor. And many members repeatedly said to me how much they appreciated the one-to-one training on how to use technology. I happen to be a Facebook user, so I used Facebook on a regular basis and always appreciated the positive messages that the WESAC Facebook site would put out daily to help people stay positive. Our WESAC website was very good during this period of time. There was news items, there was other informational topics on how to stay healthy, and they had fun activities that you could do on the website, like crossword puzzles and things, because, you know, during COVID, it was a very boring time when you couldn't get out and do much and talk to people. So it was nice to have things that you could do. During this time, an newsletter was started, which I signed up for. And this was very, very beneficial in getting really up-to-date COVID information as to restrictions, precautions that needed to be taken during the time. And as you well know, regulations kept changing, you know, almost daily at points in time. So this was a really good source to keep informed. The other members relayed to me that Zoom helped them stay involved with their church, to make ongoing family connections, because to seniors or grandkids are really important, and to, you know, not be able to see your grandkids on a one-to-one basis was very distressing. So Zoom really helped with that process. And Haidong already mentioned the use of telephones. And I've had seniors also tell me how much they appreciated those friendly phone calls during a very boring day. I think one of the things that some of us as volunteers found was that many seniors have devices like cell phones and tablets, but they aren't really aware of maybe all of the capabilities of those particular devices. And so just somebody sitting or talking them through how you can use FaceTime, for example, on your cell phone, how you can use the messenger aspect on Facebook so that you can have private conversations. And then basically the Zoom, YouTube was very useful to many seniors as well. So I think that what we have found at our center was that COVID seemed to speed up the acceptance and the comfort level of using technology. The skills that they've learned have made them feel more comfortable, and we're finding that more seniors will register online now, pay online now, as opposed to simply standing in line to sign up for a class or to pay for their classes. So we still are running into situations where seniors are fearful to return because of their fear of COVID. And so some seniors have continued and preferred to continue on taking their classes via Zoom. And this is very beneficial if they are challenged physically in terms of getting out to the center, or they have poor transportation to get to the center. So we view technology as a really important aspect of our senior center. So I will conclude with that. Thank you.
Thank you, Haidong and Barbara. And last, we have Connie Avila, who is the Chief Innovation Officer with Covenant Health, and she's going to discuss a platform that their organization has developed to help innovators plan, pilot, refine, and scale innovative solutions that address challenges older adults have identified. Over to you, Connie.
All right, can you see my screen okay?
Yes.
Okay, perfect. All right, thanks so much for having me. And wow, what a powerhouse of presentation. So I'm gonna try to be super quick, and I know I'm kind of running out of time, but just really quick that we're really proud at Covenant to be really part of the plan of a humongous innovation agenda and being able to play with technology and rolling out different ideas and trialing different ideas. So for us at Covenant, really innovation and technology go hand in hand. It's more about than just widgets and gadgets. It's really about recognizing that we're at a crossroads in seniors care in Alberta, and that we need to challenge the current models to find better ways of doing things, determining how best we can integrate new thoughts and technology. It is also important to be part of kind of like being a bit of a broker role, being able to articulate the problems and the challenges that we have end user driven within our residents, our staff, but also to translate those to the technology solutions that are out there and to help those partners to really help us solve those real life problems. So for us, innovation and technology must have the ultimate goal to improve the quality of life and then also be a value add. And in order for us to kind of like showcase some implemented technology, or we better call it technologies under the key strategy, it's really important sometimes to take a bit of a step back. And at Covenant, what we have done is really together in partnership with SE Health in Toronto, we developed a Courage initiative that is called Action for Better Aging. And what it does, it was launched to start a movement for change and mobilize a coalition. And what we did is we engaged really with over 800 stakeholders and set a roadmap and a plan for action within the seniors area to then really strategically position our innovative solutions under that kind of a vision and the findings that we could kind of find out where we're heading. And since really it's not a linear process when you're trying to make a real systems shift. So in the meantime, it is most important to provide ourselves as trialing out different ideas. I just saw it also in the Q&A and asking about some of the more detailed questions. What about hearing impairment? What about this? What about that? So what is important is that we're willing to try in an effort to make things more sustainable and better. So once the vision is clear and we build out our innovation efforts, a couple of those examples, just to name a few, is on the right hand side, you see the Tovertafel. So that is really an innovative system for those with mid to late stage dementia, which allows seniors to interact in a cognitive and social ways that aren't really intimidating. So with huge impacts on residents and staff, that they have benefited from the entertainment, connection, and play. On the left-hand side, you see a technology called Abby. It's an interactive technology that invites residents really to an activity where they can easily do things like petting the cat or driving through a country road. And that really promotes independence, encourages cognitive stimulation. And for staff, it is a positive intervention option as well and provides a meaningful way to engage with the senior. Tim just talked a little bit around the virtual reality around dementia care, and we're trialing out different solutions too together with Alberta Innovates, and we're quite grateful for the opportunity that we have and really opening up our kind of 27 sites that we have all across Alberta within the Covenant family. So quite excited about that. But really, I would like to mention, to just close it off, that our ultimate goal is to be part of the systems transformation. And Tim just mentioned it as well, to be a bit of a convener. So what we want to be seen as really being a solution to the many, many problems and trying to help to make life better. So we recognize that the time is now to create an unparalleled momentum in the system. And the situation that we find ourselves collectively demands that we find urgent system-wide solution, whether it comes to the workforce challenges, the economic challenges, capacity challenges, or expectation that we increase options for living independently or longer in community. So we have nothing but challenges on our hand, but if we put our great minds together and break down some of the barrier and advocate together and then also test within our sites, I think then we're really onto something in Alberta. And we have the opportunity to learn from nationally and internationally. So that is quite unique and exciting. So we really have the opportunity to respond to aging in a way that harnesses the power of community and innovation and the meaning of all sectors. So we need to integrate the sectors, the systems, and innovation and technology are here to help us, not to be a burden, rather to really enable us. So in that sense, if we intentionally go in towards that mindset together and try out different ideas, then we really can drive a real change. So I'm just going to put up that slide really quick. So if nothing else, click on our website. I know we ran out of time, so I browsed through it super quick, but it's called actionforbetteraging.ca, and you can find out more about the kind of the national roadmap that we have been embarking on, and quite excited about to lead such a conversation, and very, very grateful for this group here and for the invitation today. My apologies that it's quite rushed, but meaningful nonetheless.
Thank you very much, Connie. And Jordana, I'll just ask you to share my slides. So unfortunately, we are short on time and won't be able to engage in further discussion, but our speakers have been great in answering questions in the Q&A box. If you do want to advance health and social system policy, education, and practice, we encourage you to consider becoming a member of the Alberta Association on Gerontology. You can go to our website to learn more about our types of membership and member benefits. On our website, you can also find resources from past Futures Policy Forum webinars, such as speaker slides and webinar reports. Following today's webinar, you will be prompted to complete a survey. We encourage you to complete the survey to share your thoughts and opinions on the topic of technology, and this will help to inform our future initiatives around technology. And responses to this post-webinar survey will be compiled and summarized in a report, which will be posted on the AAG website. Make sure to mark your calendars for the last webinar in our Futures Policy Forum initiative, which is going to focus on innovation in community-based housing Registration will be available soon on the AAG website. And I want to thank our speakers very much today for their great informative presentations and for everyone engaging in the Q&A. I hope everyone has a wonderful afternoon.